what are the kinds of questions that they're bringing to you? How do these conversations, these partnerships get started?
Typically, it starts with, how can you save us money? Everybody's strapped right now. You see it across basically every industry. But when we think about specifically like GLP-1s, we're already seeing that the sort of pot of dollars that a health insurer has to work with is not enough to cover all of the patients that A, are eligible for the drug based on the FDA approval, but B, want the drug. There's a lot more patients out there that want the drug that may not have diabetes or, even I would go as far as say aren't obese by definition of what your BMI is. And so we are already starting to see some of these health plans quite literally have to lay off their workforce because they've just gone above and beyond what their budget is for their pharmacy spend. And specifically noting that GLP-1s are a big source of, what's sort of pulling those dollars away or where they're.
So if I heard correctly, in the industry, the cost of supporting GLP-1s for even just the folks who deserve it or who qualify for it medically, and if you include the rest of the folks who want it, is straining that care budget to the point where insurers have to lay people off in order to fulfill those insurance obligations?
Exactly. And I would add, if it's okay, patients are suffering as a result of this too, because if you look at North Carolina, for example, they initially offered coverage for weight loss for GLP-1s, but spent $100 million on it, went completely over budget. And now we're in a situation where they can't cover it at all. And so we really need to help find that sort of happy medium of where we can provide coverage to the patients who need it most in a cost-effective manner. But unfortunately, if we let everyone who qualifies for GLP-1s, which given the expanding set of indications could be more than half of the US population, we would completely bust the budget of our healthcare programs.